Well, 2020 has made a lot of things more difficult, including child care. And here to tell us a little bit more about how we can keep our babies and children safe during a pandemic is Dr. Kirk. Dr. Kirk, let's start off by asking you, why is it so important to discuss this with new parents and guardians?
Well, thank you so much for having me on and for having the opportunity to really amplify the message that all pediatricians and family practice providers have at the moment, which is really to get our children back into the in-person well-child visits, especially for infants. This is a really important time for us to be able to screen children, ensure that they're getting their developmental assessments and their in-person exams met. During COVID-19, we know that everything has turned upside down for so many families and across our society. And one of those things that we've seen is that people are not going into in-person visits as much as they used to. And so we're really here to kind of talk about some of those concerns, including infection control and what is really available to you and your families when you're able to bring your child into a clinic visit in person.
Absolutely. So what are some things that parents and guardians should keep in mind before their first wellness visit?
So one of the things that parents often will ask and have questions about is what kinds of infection control protocols or standards are put in place in pediatric or family practice offices. And I can tell you that before the pandemic, there was always standards of care in terms of infection control. And certainly during this pandemic, all of those standards of care have increased. So every practice should have information on their website, their phone system, or a protocol in place that they can explain to families and patients as they're going through their scheduling process of what to expect when they come in for their visit. Some practices have actually gone so far as to put videos online to be able to walk families through the clinic experience to help prepare them for what to expect. Oftentimes, there's a set of screening questions very similar to other screening questions that might have occurred at the workplace to ensure that family members aren't coming in with COVID symptoms. And wearing a mask and basic hand sanitation, et cetera, are practices that most practices are going to have in place. In addition, infants that we know we're trying to protect most vulnerable infants from potential infection often will have a separate time in which their well child visits are being scheduled apart from other visits within the clinic.
Definitely. Now, this is all very valuable information for our viewers. Can you tell them where they can go to learn more?
Sure, there's several different websites, and United Healthcare has produced a landing page for you at uhc.com/children's wellness, as well as everypregnancy.com, which talks about healthy pregnancy. We certainly want to promote going to see the website for the cdc.gov, as well as the American Academy of Pediatrics has a website called healthychildren.org with all types of information for families.
Well, thank you so much for this information again, and you can find all of this and more on our website at firstcoastliving.net.